Well, let me be clear. I am nobody's boss. And let me also be clear, I am never the smartest person in the room. So, very interesting talks, and I want to make sure that we leave plenty of time for questions, so I may actually be shorter than Ramon's talk. And really what I want you to kind of get a sense of is what we do in global affairs, what we've done in the past, where we're going, and how our infrastructure allows us to operate in SAGES, and then we can talk about what you can do. I'll make, as being on the Global Affairs Committee for many years, and now having the chance to lead it, I think what you find is people come in, they're very, very excited, and they want to travel, they want to help, understand that many times it is not fun. You do it more because it's enriching, and it enriches your soul more than anything else. So I really encourage, if you're into global surgery and helping out, whether it be humanitarian or disaster, really try to understand why you're doing it. Everybody has stories. Some of them are heartwarming, some of them are heart-wrenching. So getting over this whole notion to go to really cool places and have some fun, or see the world and travel, I would encourage you to really look at it in a more mature light. And we do it because it enriches your soul, and maybe it's part of getting older, maybe we've all got holes in our souls that we need to enrich in other ways. And one of the things I think moving forward is going to be financial. And what do you mean by that? Part of volunteerism is financially maybe paying your own way. We, as many organizations do, may have some limitations in our budget, limited access to funds. And one of the things we may be asking is please help us out. We can get certain things. We can get your lodging, get your food, although sometimes that's a little sketchy. But there may be additional things to ask of you other than just your time, and your time is valuable. Don't underestimate how valuable your time is. So that's the end of that part. I have no disclosures other than the fact that I am the current chair of the Global Affairs Committee. So what do we do? So it's SAGES members. So you got to be a member of SAGES to be a part of the Global Affairs Committee. It's committed to the international SAGES mission to drive adoption and sustainability of basic laparoscopic and endoscopic procedures through education, research, innovation, and training. Pretty straightforward, nothing that you wouldn't expect. So we just kind of revised. We made a big revision in what we did about six to 8 months ago. And our mission statement is pretty simple: to promote adoption and sustainability in gastrointestinal endoscopic surgery internationally through education, research, innovation, and training to improve patient care. Key word there is sustainability. One of the things that we found, not so much with the global affairs, but if you look critically at other medical missions, who go and go to a remote area of the world, do surgery, deliver medical care or whatnot, then leave, and there is no focus on sustainability of education, of training. I think one of the things that you find is that population then will wait until that 1 or 2 weeks out of every year. Wait for the Americans. Wait for the doctors, wait for them to come, and we'll get X, Y, and Z done. My own personal bias, and I'm editorializing here, is sometimes that leads to neglect. And we were a little bit sensitive to that. And so one of the things we feel very, very strongly about is creating a sustainable program. And we'll talk a little bit about this and some of our big successes. This is our team. So what do we do? I'm going to overgeneralize, but I guess that's what we do when you're giving a 15-minute talk. We do 5 things, global affairs. So we've started what's called the ILab, International Laparoscopic Advancement Program. We don't call it a course, although it is a course, but it's a program. It is operating with surgeons. It is educating surgeons. It is educating residents. It is educating medical students. It is educating hospital administration. It's educating nurses. It's educating people to help create a sustainable program. Because what we want to do, we're most successful is when they're killing it, and I mean that in a good way, when we're not there. They're doing cases, they're doing laparoscopy when we're not there. That's success. We do many international collaborations. We collaborate with governments, with other organizations internationally. We have some industry collaborations as well. Ethicon China sends surgeons over in a kind of an academic exchange program that we help facilitate and sponsor. Haiti, Paul talked to you about Haiti. Much of what we do are projects that may have evolved elsewhere. Perfect examples of that are Ray Price in Mongolia, Paul Severson in Haiti, and Adrian Park, I'll briefly touch on it, in Africa. So when you ask the question, how can I get involved? What can I do? My answer is actually a very simple one. Help us. Pick up the phone. If you're from a country, if you have connections to a country, call us. This is what our website looks like, and I'm gonna just try to keep it pretty brief here, because I think Ramon touched on a lot of what we do in global affairs. We've got a history. We've actually gone to over 25 courses in Argentina, the Cape Verde Islands, which is off the western coast of Africa, China, Haiti, Peru, Mongolia, Nicaragua, the Philippines, and Tanzania. In 2016, we have a webcast, so much of this meeting is being webcast around the world. Last year was 67 countries. I don't have the statistics this year, with over 2,000 additional viewers. And I think it's very important for our international partners. We develop relationships all over the world. These are some of the relationships that we've developed in different parts of the world. These are organizations, mostly surgical organizations. In the interest of time, I'm just going to briefly talk about Mongolia is one of our big successes, and it's not my success. I mean, it's a success that started with Ray Price. It started with an outside foundation, but unaffiliated with SAGES. We kind of piggybacked on the end of it, and of course, we can take some credit for it, but certainly not all of it. But it was a collaborative project, and these are Ray Price's slides. So I thank him for allowing us to use these. And basically, what we tried to do is regionally divide up the country and create these centers where people can go and get trained. As Ramon mentioned, we have laparoscopic skills labs. We use already validated tools to teach. Why reinvent the wheel when we have FLS training boxes, and we know that these educate very effectively. So I can honestly say, through Ray Price and his efforts and his leadership, and there are many other people involved, but through his leadership and his collaboration and his relationships in Mongolia, they've gone from about a 2 to 4% laparoscopic cholecystectomy rate in country to over 80%. That's a big impact when you think about days saved for an entire country. I mentioned the ILab program. You know, competent surgeon is in the middle. It's a combination of technical skills and cognitive skills. So for us to go in and just do cases and teach them technical skills, many could argue that's not necessarily a competent surgeon. And I'm going to go fast. And this is our newest project as we move forward. And this is a relationship that SAGES has started in Mexico with the Association of Mexican General Surgeons. And what we're gonna really get started on, it started this past summer, is getting into the country of Mexico. And you're kind of like, well, why Mexico? There's a lot of reasons why Mexico. Some of them are pretty straightforward. It's close. It's cheap. It's a heck of a lot cheaper to fly somebody in Mexico than to Mongolia. 2, Spanish speaking. Much more members in SAGES will be able to speak Spanish. We'll have less translation issues. 3, and probably one of the most important ones, is absolutely critical and absolutely vital, and Ramon talked about it, is to have the buy-in from the organization, the professional organization, the government, and a local champion. Because you can get derailed very, very fast if you don't have that buy-in. So this whole idea, if you're from a country and you want global affairs to go to that country, who's gonna be the local champion? Can I trust him or her? We had that local champion in Mongolia, and that local champion carried the torch because you're not there the vast majority of the time. We've identified that person in Mexico, so it's absolutely vital, absolutely critical. And this is a map of Mexico and where we plan on going as we do this. Our first trip is to Mexico City. We'll be speaking before Congress actually next month in Mexico. And it sounds like a big deal, but you know, these are the things you got to do. You got to get the support from the government. You got to have an in. You've got to have some way of making sure that things can happen. And this is a quote with our first course in Mexico from one of the participants in the course, and I think it summarized things very nicely. I knew 15 years ago I learned at the SAGES Association of Mexican General Surgery Educators course to help many more of my patients over my career. You know, sometimes they already do laparoscopy. And what you're there to do is really make them better, teach them how to educate, teach them how to train the residents so that they can go and just kind of perpetuate that moving forward. And so if you're a SAGES member, it's hard. It's hard to get involved because if you say, well, I want to do what you're doing on global affairs, for example, well, you got to get on the committee. You can't just appoint yourself to the committee. You know, the committee is limited. We can't have 200 people on the committee. It just becomes unwielding. But what you can do is just pick up the phone and give us a call. If you have international contacts or international interests, or you know somebody somewhere, give us a call. Call me, call Jacqueline, call Ray, call Brant Olschlager. I mean, we'd be happy to hear from you. Now, that doesn't mean something's going to happen because of all the criteria that we talked about. It really needs to be in place. But yeah, just give us a call, give us an email. Do you have unique skills or languages? If you do, give us a call. There may be some opportunities that exist. Do you already do international work? I mean, this is where global affairs has actually been very effective. Ray has already done all kinds of international work. And then we kind of piggyback on. Paul, all kinds of international work, kind of piggyback on and help out in any way we can. Adrian, same thing, just in different parts of the world. Social media and public relations, we were having a discussion earlier in the week. You know, this is something I don't do well. I think we as Global Affairs Committee don't do well. We need help getting the word out. getting on social media, doing public relations, letting people know what it is we do, and we're available as well. And as I mentioned first, the biggest thing you can do to get involved is help us. Let me know your ideas. And I'm a big fan of throwing stuff against the wall and see what sticks. And I think that's how great things happen.